What's up, guys? Today we're going to talk about pain down the side of your knee, or what's referred to as IT band syndrome. Now, we're not going to diagnose or prescribe any treatment for you, but we are going to talk about how that referred pain down the side of your knee can be the cause of an inactive glute med or glute max and overused tensor fasciae latae or TFL band. Now, what we're going to go over is how we can activate those tissues that are inactive and help to stretch out the tissues on the hip so that that referred pain can go away. Now, a lot of times when you're running, this can happen because of either a mechanical issue within your stride or not being able to utilize those muscles of the hip like we talked about, the glute med and the glute max. So we're gonna go over some stretches and some activation stuff and some hip mobility exercises that you can do right now to help you to perform better and to feel better and not have that referred pain down the side of your knee, because it can be very painful. One of the things I wanna go over though real quick is not foam rolling down the side of your leg. That can just cause more inflammation down the side of your leg. That IT band going all the way down the side to your knee is an extremely tight and tense fascia that is very difficult to change the tissue. So what we are gonna focus on is proper movement and then proper activation or proper use of the tissues around that IT band. So it connects real quick, it connects all the way up here in the pelvis, and then it runs all the way down here and connects to the knee. And then you've got your TFL in front, you've got your glute med, and then glute max. So those are the tissues that we're gonna focus on. Right now, I want you to grab a couch or a bench, post yourself up, and let's get to it. So we're gonna hit this left side. I want you to post up and then sink down. Now from here, what I want you to do is try to rotate towards that leg that you're having pain. And what I want you to try to do is get a stretch on the upside towards that glute med, that glute max, just like so, by driving out, opening up towards that front leg. And you're just gonna hang out here for about a minute. And you're gonna try to open up so you feel that stretch on the outside as much as you can. And just hang out. And so this first one, all you're doing is just hanging out, breathing into it, driving your knee out, coming back in, exploring that range of motion, just to try and feel that stretch on the upside. Number two are hip airplanes. Now, when I open and close my hips, what does that for me is my glute med. So that's really what we're gonna target right here. You're gonna get a stretch on the outside as well. So right here, single leg RDL basically. I come forward, it helps to use something to hold yourself up. I'm gonna drive my opposite hip up and then pull all the way down, feeling a stretch on that outside. You feel a similar stretch of what we just did if you're doing it correctly. Again, activate, drive up, and then come back. Thinking of these tissues, squeeze, and then stretch. Squeeze, stay nice and tall, try not to crouch. Reach that heel back, open, and close. About 2 sets of 10 reps each leg will help with that. Last one, you're popping down on the ground. Now we'll flip to my right just because of the angle of the camera. I want you 90-90, left leg in front, right leg in back. Now, you can either feel this in your TFL, which we don't want. I want you to try to activate the glute and the glute med right here. So post up, I'm gonna lift off and hover, come back down. Lift off, think of squeezing these tissues here in the back, come back down. Up, back down. Now if this is too difficult, pop down to your elbow. So it would look like this, 90-90, boom, down to your elbow, lift off, think of that glute, back down. Now when you first do this, if you do have that referred pain, you're probably gonna feel this more in your TFL as opposed to your glute med and your glute max. But if you continue to practice it, it will get better. And continue to slowly add back in that running, slowly add back in your lifting, slowly add back in whatever was causing you pain. But stay consistent with this for at least a week and you should start to see relief with proper movement. Have a great day.